thank you, Sia, for this lovely introduction. So what we're talking about, how do you find a therapist, right, or mental health? So why? First of all, why do we even talk about this, right, in the context of cystic fibrosis? And I think everybody here knows that, first of all, right, there's no physical health, so there's no physical well-being without addressing emotional needs and emotional well-being. Depression and anxiety are common in people, period. And we also know, according to the TIDE study and other studies, that depression and anxiety is 2 to 3 times more common in people with CF. And the psychological distress, anxiety, and depression, they lead to worse physical outcomes, decreased pulmonary function, increased rates of hospitalizations, increased healthcare costs, decreased health-related quality of life, and potentially, if somebody eventually moves on to transplantation, it can also affect those outcomes, and it can also affect even mortality and survival of people with CF. And that's actually similar to other chronic medical conditions as well. I just want to point it out as well. And now, right, as we see so many of our people, right, others are benefiting from amazing CFTR modulators, right, such as Trikafta, so far, right, people, there's additional existential concerns, right? While many things are getting better, which is amazing. Maybe for many people, lung function has stabilized. People aren't getting admitted as much. But then there's new questions. Wow, now I'm living longer, right? For some people, that's actually kind of this big question, right? I haven't planned for, financially or for this and that. So actually new questions come up for people with CF, even with all this improvement. So depression, anxiety, and just, psychological distress of being human, for better or worse, will stay here with us. So okay, here we go. So when should you seek therapy, right? And first of all, kind of what is therapy? Therapy goes by many names, right? Therapy, counseling, talk therapy, psychotherapy, they all refer to the same modality, right? And it's a therapy between a professional licensed mental health provider, right, and an individual with some sort of psychological distress problem or just seeking to find out more about themselves, right, but they connect, and usually in one-on-one, sometimes in group setting, right, through evidence-based psychological practices, right, they really learn more about the psychological needs of the person, about the psychological makeup, and learn how to deal with certain challenges, learn how to cope, learn how to maybe reframe thought, or gain more insight, right, or look at life in a different way. And again, as I said, like it goes by many different names: therapy, talk therapy, psychotherapy, counseling. Pretty much, they're all the same things, right? And who can be psychotherapist or therapist? It can be a psychiatrist, right, like myself. It can be psychologist. It could be licensed clinical social worker. It could be marriage or family therapist, right? So actually, there's a lot of mental professionals who receive different training and can do different things, but they can all administer and deliver therapy, right? So that's important to know that psychiatrists can do therapy, but they can also, provide medications, and not all psychiatrists do therapy, but many other excellent providers provide wonderful psychotherapy. When to seek therapy? Well, of course, you might be seeking therapy when you do have a diagnosed psychiatric condition, such as depression. Maybe it's major depressive disorder. Maybe it's part of the bipolar disorder. Anxiety, right? There are a variety of anxiety disorders: obsessive compulsive disorder, panic disorder, generalized anxiety disorder. Maybe it's some sort of, some anxiety that is not as well characterized. PTSD, post-traumatic stress disorder, which can happen, of course, in the context of, obvious trauma, such as, somebody underwent terrible assault, right? Physical abuse. But we also see PTSD within the context of living with a chronic medical condition, right? Growing up as a child who's constantly poked with needles, right? This and that, or even coming to the appointments, right? PFTs can be traumatizing in a way, right? We see it in our lung transplant recipients. So PTSD can definitely come up within a medical setting as well. Substance use disorders, that's also might be something that is important to seek treatment for, and therapy can be part of the problem, part of the solution, right? And of course, people can also be actually self-medicating themselves, right? Their depression, anxiety, or something else with misuse of the substances. So that's always an important question. But you don't have to have a diagnosed psychiatric condition, right? Like depression, anxiety, PTSD, substance use disorders. You might be just feeling overwhelmed and stressed. You might be thinking or worrying about something, and it's not just comes and goes, but it really occupies you. Let's say for more than an hour per day, right? To the point that it's actually hard to concentrate on something else, right? If maybe you avoid doing something because of your anxiety and worry, or it prevents you from sleeping well, or it even affects how you medically feel. You might be feeling tired because you worry so much. You might struggle with low motivation, right? You feel hopeless or stuck in life, right? Not feeling like doing much. You feel like you want to change something in your life, but you don't know where to start. And it's hard to do anything new. That kind of sounds like me, but that actually might be something excellent to explore in change therapy. Something I don't have here, but I realize, for example, eating, right? Disordered eating or eating disorders can also be excellent indication for therapy, right? Coping with chronic stressors. I mean, life, right? Just coping with life, like that's an indication right there, right? But then, in addition, living with a chronic medical condition and navigating life while navigating living with CF or transplant with all the stressors in the world, that might be the reason to seek therapy. Relationships, right? Maybe it's difficulties maintaining relationships or navigating relationships. Maybe some dilemma, right? That can be also a great indication for therapy. Transitions. Transitions can be great transition, exciting transitions, but they can also be, stress inducing, right? Even like, getting married can be obviously a wonderful occurrence, but also can be very stressful, or getting divorced, right? So really any transitions can be stressful. Sometimes it's just about finding out who you are, right? Kind of something more inside oriented. Who am I? What is the meaning of life, right? Why am I here? I want to understand why, kind of why I behave the way I do in certain situations. What are my triggers? Or maybe it's about processing past trauma. So as you see, right, there are many reasons to seek therapy. And I think if you're questioning it, right, then it might be something worthwhile to look into. You might have a very obvious question or worry, or you might feel that there is something quite not right and you want some help, but you might not have a well-formulated question. And that's something that potentially you can even come up within therapy, right? Really formulate that question. How to find a therapist, right? I know that it's not easy, right? It's not easy. There's so many, as Siri already mentioned, obviously, there's so many barriers, unfortunately. And I think one of the biggest barriers that we have, at least in the United States, is of course the insurance, right? For even at Stanford, right? This is why we actually have integration of our services into the CF center, right? My services is that, medical side can be accepting an insurance, but psychiatric side does not, right? For reimbursement purposes, right? So, different centers take different insurances. Then we have providers in the community. Many of them don't take insurance. But even if they don't take insurance, you likely can apply for reimbursement, right? Something that's important to remember. So it might be hard to find a therapist, even just for those reasons. But how do you go about it? Well, I think honestly, the first step would be actually asking your CF social workers or other providers of your CF clinic. Mental health has been on the minds of the CF centers, CF culture, CF providers. They know, I think they know how important it is at this point. So that's a great starting point. Telling your social worker, right? Or asking other providers. They might be providing services themselves, actually. And I will talk a little bit later about some of the evidence-based psychotherapies that are now being studied in cystic fibrosis, which is exciting, and even being provided to the CF centers. So you can ask your social workers or other providers, do they actually provide therapy in clinic? And if not, then whether they have connections or referrals. Because again, many of the social workers or mental health coordinators or even other providers, they have lists of people that they refer to. Like I have my secret contacts that I refer people to, right? And I'm not going to be disclosing them here, right? But sort of like, we work with people in the community or in other centers that we want to send our patients to. So that's a great starting point. If you are affiliated with an academic institution, right, such as Stanford, UCSF, or other obviously places in the country, you can also ask to be referred to the psychiatry or psychology department. Because again, there are those connections, there is a referral process. So that is something that can be accomplished. Again, so this, I'm sure that's similar in other, in other states, right? But for example, there's sort of a difference again about insurance. If you have account, a Medicaid type of insurance, sometimes you have to go through a different process, like Medi-Cal in California, and you might actually just Google the mental health services in your county, and there will be a phone number that you can call, right? And they will connect you with mental health services in your county, and that might be another great way. If you have a primary care physician, you can also ask for referral. Another great way is actually calling your insurance company, right? There's always a behavioral number. You kind of have to look for that, but there's also a behavioral number on your insurance card, no matter what it is. And you can ask them, who are the providers that are covered by my insurance? And that might be a wonderful way to find a provider who's also covered by your insurance. Sure, you might have to call many providers, but that's probably, that can be part of your behavioral activation, part of your treatment. Psychologytoday.com is also actually a great site where many of the mental health professionals, psychologists, social workers, and so on, psychiatrists, they put in the information there, and you can actually search by where you are, by the insurance that you have, by particular modality type of therapy that you're seeking for, right? By particular type of therapies that maybe you're looking for, if you have particular characteristics such as the gender or cultural background. So you can input that and kind of see who comes up. So that might be a wonderful resource. There's other locators. This is, I have it also locator.apa.org, and this is from American Psychological Association, right? But again, if you go on their website, they also have a database of many providers, and you can again search by name or by a zip code. And then I also want to remind that CFRI does cover 6 sessions, right, per year with a contracted community therapist, right? So if you have your therapist, if you found that therapist, you can connect them with CFRI, and you should reach out to CFRI, and they will help you start with the therapy. And also, don't forget, if you find someone in the community who does not take your insurance, always think about still applying for reimbursement. You actually be surprised, like how generous the insurance companies actually might be with reimbursing you, even if you're paying out of pocket upfront. So these are some of the ideas. I mean, there might be some other ideas, but I think this might be a good starting point. Now we'll move on to, we kind of talked a little bit about what's psychotherapy, and I mentioned modalities. So, what kind of psychotherapists are there, right? Well, there are a variety of schools of psychotherapy, right? So meaning, particular types of ideas that we apply to how people develop, how people think, how people function, and how people can change, right? So one of the more classical schools of psychotherapy is psychodynamic psychotherapy. And even something that comes in before that is psychoanalysis, right? You think about Freud, you think about the couch, and psychoanalysis is actually very intensive, usually done like 3 to 5 times a week, where you would come in, probably, I'm not sure if CFRI covers that, because there'll be like 1 week of treatment, right? You would come in and you might lie actually on the couch, and the therapist is going to be behind you. The whole idea is that the therapist is the blank slate, right? That you don't have this face-to-face interaction, right? Because when we see the other person, we do respond to their facial expression, this and that, and you really want to remove that from psychoanalysis, like the person is truly going to the psyche. So it might be wonderful practice, but probably it's going to be very expensive to find a psychoanalysis, but can be wonderful for some people. Psychodynamic psychotherapy, it's really focusing on understanding the past, childhood, relationships, maybe trauma, and really thinking about how your past experiences really relate to your present, right? How you function right now, right? Your defense mechanisms, how you relate to the people. And honestly, all of the more current, for other psychotherapists, I mean, they've taken some root in psychodynamic psychotherapy. I think most psychotherapists, even if they don't overtly practice it, they have a good grounding in that. It's really hard to help somebody without actually understanding, right, where people come from. So frequently there's some basis of that. Then we think about motivational interviewing. Motivational interviewing, especially we think about that when we work with people who have substance use disorders, right? Where we really, the goal is to change some behaviors. It's really patient focused, right? It's trying to talk to the patient, understanding where are they, and then listen to the talk of change from the patient, right? You might have ambivalence about, for example, do I want to continue drinking or not, right? And nobody, right? And it's really a personal choice, right? Nobody can make people do anything, right? It's really talking about their values. What is working for them? What is not working for them? What would they like to change? So motivational interviewing is a type of psychotherapy that is really trying to work on, again, eliciting that talk of change from the patient themselves, and then working on that change. Some of the more, fashionable psychotherapies that you might have heard, they also evidence-based psychotherapies are cognitive behavioral therapy, CBT, and acceptance commitment therapy, ACT. And both have now studied in the world of CF. That is super exciting. Cognitive behavioral therapy really looks at the relationships between our thoughts, right, like cognition, what goes through our minds, our emotions or feelings, and our behaviors. And it looks at how the thoughts and emotions and behaviors are all connected, right, as well as actually how the stress manifests in the body. And so what you do within cognitive behavioral therapy, you really increase your awareness of how you think, right, how you feel, what triggers you. And then you might work on identifying which thought patterns are actually maladaptive, right? We call them cognitive distortions. And then the ways to reframe those thoughts. Doesn't mean that we negate and we say, no. Instead of everything is terrible to everything is amazing, but really finding that gray zone, right? Let's look at the stuff that is not working. But let's also look at things that are working and finding the middle ground. Finding the ways of coming up with a more adaptive thinking, right? We can also work on some behavioral changes, for example, like behavioral activation, which can be very helpful in depression. And it is being studied right now, as I said, in the world of the CF. In Stanford, we were part of the multi-site study, was the main site, MGH at Harvard, with Dr. Deborah Friedman and Dr. Anna Georgopoulos being PIs on this study, and kind of really looking, adapting CBT to 8 sessions and then delivering that to people with CF. And there's been some presentations, for example, done, at CF Foundation. And now what we're working on is actually implementing this modality into other centers. So there are social workers and other mental professionals from other institutions that are involved in the implementation studies. They're now bringing it to their patients in CF centers, and they have supervision from somebody like myself, Dr. Georgopoulos, Dr. Kuhner, right? So you might ask at your center, okay, are you guys part of this CF-CBT implementation study, right? Are you providing CF-CBT? Because there are other providers now in the CF centers who provide this. There's also acceptance and commitment therapy. It's a different type of evidence-based neuropsychotherapy, and it works. There's some similarity with CBT, but it really works on kind of, we're not going to necessarily work so much on reframing the thoughts, but we're actually going to accept the difficult thoughts and difficult feelings, they're part of life, right? So kind of accepting the reality, but also then committing to living according to your values, right? And we're going to accept that maybe we're going through this difficult patch, and yet what are your values? And right now, what can you do to live your best life according to those values? It's also being studied in CF. There's also been studies that have been published, and Dr. O'Hare, who has been a PI on that study nationally. And I know that, again, some centers are still delivering that. Just you might ask your center as well. Some other psychotherapies are interpersonal therapy. That interpersonal therapy focuses on more kind of creating more social support. If there's some changes in role functioning, for example, right, a new mom, right, and that kind of changes dynamics in the whole family, right? We're working on the grief, so some big transitions or changes in roles. Interpersonal therapy might be addressing that. And essential psychotherapy, such as meaning-centered or dignity therapy, are also good examples, good types of therapies for people who live with chronic medical conditions, right? And it really elicits big questions, right? Such as, what is the meaning of life, right? Or dealing with death and grief or death anxiety. And it doesn't mean that this is applied for somebody who is, imminently dying. In a way, I'm a very essential person, right? If you call me, well, in a way, we all deal with this anxiety every day, right? And then we push it aside. Like maybe that's why we're tearing up when we're celebrating your birthday, and then there's that sadness, right? This is, in a way, when like I'm admiring magnolias right now, right? Why are magnolias so beautiful? Well, because they only blew for 2 to 3 weeks, right? It's sort of like, it's that often that it's like the Buddhist tweet, that it's that something is beautiful and then it's fleeting, right? Just like life. So the idea is that, so just like the therapy really puts that at the center of the work, right, of the therapist and the patient, right? And when somebody does live with a chronic medical condition such as cystic fibrosis or faces transplant, right, it's impossible not to see your mortality closer. And it brings up very important life questions. And people can actually have a lot of growth from really looking at those questions clearly and close up. And then there's supportive psychotherapy, right? There's a lot of validation, active listening, and problem solving. You might have therapists who really do one type of therapy, like they mostly do CBT, right? Or they mostly do ACT. Or another type of therapy that I actually did not mention here, but which is very important, is DBT, dialectical behavioral therapy. And that was a therapy that came out of the CBT. It's done usually in individual and in group setting, and it really focuses on, helping somebody to tolerate emotional distress. There's a lot of skills building. But usually when people, you might have find therapists that really are committed to practicing CBT or practicing ACT or practicing DBT. And at the same time, there are many wonderful psychotherapists who actually practice a combination of this. They might call it like eclectic psychotherapy. So when I, for example, do psychotherapy with my patients, I do have the psychodynamic kind of understanding of the background, but then I will be using some of the CBT skills, right? And some existential skills and some supportive therapy skills. So I will be kind of using, different skills depending on the patient in front of me and and what is it that actually, the challenge that's coming up. So, and again, people might practice eclectic psychotherapy, or they might be very committed, right, to one type of psychotherapy.
Before we move on, Dr. Sher, can I just clarify? There's been success with CBT and ACT. And is there a reason why, of all these modalities, that has really emerged as something that's been very impactful for people?
Yeah, that's such a wonderful question. I mean, I think there are several reasons, right? First of all, I think it's something that actually is easier to study. Let's say psychodynamic psychotherapy, which is the more abstract, right? There's kind of more pondering. Versus in CBT and ACT, right? Like there's like, okay, this is what we're gonna do, right? Like this is the skill we're gonna learn today. Today we're gonna talk about reframing your thoughts. Then we're going to work on relaxation techniques. Today we're going to work on behavioral activation. Then I'm going to have you do homework. Then you're going to come back next time and I'm going to see, do you do your homework, right? And often, kind of also the culture of this therapist has been that we use scales to measure things, right? Page 9 for depression, let's say, get or something else, right? So there are other ways that we kind of measure before and after, has this been successful? So I think these are some of the therapies that are really focus on here and now. They really focus on skills building, right? It's really like empowering patients. We're going to say, okay, we're going to do 8 sessions or 12 sessions or 20 sessions, right? So there's sort of like time pressure versus leaving it kind of open-ended, like you might do psychodynamic psychotherapy, psychoanalysis, right? So, and we can manualize it, right? There's manuals written, therapists follow them, then we measure that to enhance, right? So more studies can be done. Right? So there's something that we can measure, something that we can clearly, study, something that we can structure and analyze. Does it answer your question?
Very much so. Thank you.
Yeah, absolutely. Absolutely. All right. And the other thing I want to say that, at the end of the day, actually, right, there are multiple wonderful modalities, right? And at the same time, what actually has been shown to work the best is actually the rapport between the patient or client and the therapist, right? So if you do not have actually a good rapport with your therapist, right, no matter what they do, might not work, right? So having that, and at the same time, if you have amazing rapport with your therapist, then they might be using a variety of these techniques, right, or one or more, right, and that might be really good. So really finding the person with whom you click, with whom you trust is important. It doesn't mean that you're going to like them all the time, or it doesn't mean that you're going to like what they say all the time. In fact, right, you probably won't, right? Because therapy is about change, and who likes change? Like nobody likes change, right? Cognitively, we like change. It doesn't feel good. So, but it's so and you might even feel a bit worse before you feel much worse before you feel better, because you're really going to go there. The point is, do you trust that person, right? Do you still feel supported with them as you go on maybe even painful journey of self-discovery and growth, right? But rapport is important, and yet it doesn't mean that you're going to like your therapist and you're going to feel good all the time. How do you find a therapist, right? So I gave you some kind of ideas of where you might start looking for them, but eventually, like, you get numbers and you keep calling. And I'm sorry, it can be such a frustrating process, especially if you truly are depressed or you truly are anxious, right? And then you have to do all this work. So if you can ask maybe your family, your friends to help you make some of those phone calls, that's also great. But eventually you will need to talk to a provider, right? And ask them questions when you get them on the phone, right? And what is the practicality? What are the problems that they treat, right? What are the hours? What is the cancellation policy? What is the price, right? Kind of, again, do they take insurance, or do they help you with the reimbursement? Would they do that in person or virtual? Now, most providers actually provide virtual services, which is great because it really opens up who you can actually see. And then, of course, the question is, what is the difference between in person versus virtual? Well, I mean, I as a provider, I've done both. What I find, patients who have already known very well and who will switch to virtual through COVID, for most of them, I don't think actually, I don't think the connection or the quality has changed, right? And it's actually easier for people, right? Because they don't have to drive whatever an hour, look for parking and this and that, right? In that sense, it's easier, or worry about infection risk. For some people, coming in person is important because that is part of the actually therapy for them. It's part of the behavioral activation. No, I'm going to get up today and get ready and drive and think about having therapy. And I've also highlighted for some people, like, I actually want you to come in. For some people, coming in and just seeing face to face, like that, the connection is important. So I think ideally you would want to meet your therapist a few times in person. And definitely there are therapists who would only want to do this in person because there's definitely something about seeing the whole person, right? In 3D with the whole body language. Also, you cannot be distracted by your phone, right? Under the Zoom, right? So, there's definitely benefits of in-person therapy and also virtual, right? So, I think try out, if you feel that you have a connection virtually, great. If not, then maybe try in person. You schedule your appointment, maybe you will try several providers, and you think about your goals. What do you want to accomplish, right? How would you know that you're feeling better? Is it that you get up every day at 8 o'clock? Is it that you're taking your hobby? Is it that you start, start doing your job, whatever that is, right? Is it that you start avoiding going to certain places because of your panic attacks, right? So just kind of define, how do you know you feel better? And you probably want to give 3 to 5 sessions to really know if the report is there. There are cases where you meet somebody for the first time, you're like, oh my gosh, there's no way. Or maybe, right? But if you're sort of not sure, right, it does take several sessions to get to know, right? Because in the first few sessions, therapist is going to be probably taking, it's not going to be so much about the therapy, it's going to be really getting to know you, right? They're gonna ask you lots of questions about your past, right? Which is, of course, kind of how did you grow up, your social history, your family, right? Your psychiatric mental health history, your medical history, because they really want to get to your substance use history, right? Because those are all very important questions for them to understand who you are as a person, where you've been, why you're here, and also for them to have the understanding of you and kind of have their goals and think about how they can help you best. And they might ask you to do homework, so please do it if it's assigned to you, because it will be more helpful. Reflect on what's coming up for you, right, in between the sessions, right? Kind of see if you, when you leave the session, are there some feelings, right, memories, images that come up? Bring it to your therapist next time, right? This is how you can also help, right? You can be a more active participant by kind of really thinking what comes up for you. Maybe you have dreams. That's very psychodynamic, but this is so helpful. Maybe there are interesting dreams that come up between sessions. Bring them to your therapist, right? Journal, again, reflect, be honest, and be honest also what's happening in the therapy. Let's say there's something that happened last time and it didn't feel right. Bring it up to your therapist. Honestly, it's such actually great material for working, because another thing that therapy does, in a way, it's actually kind of a microcosm, right? You have multiple relationships in your life, right? This is obviously a professional relationship with a therapist, but it's an example of a relationship, right? And often it's a kind of a practice. Let's say you feel awkward, but maybe that doesn't only happen with the therapist. Maybe it happens actually outside. Wonderful. This is where you can actually really work on this and process that. So whatever comes up for you, bring it to your therapist. And honestly, your therapy will go faster. And again, as I said, it might feel worse before it gets better, because that's part of the growth in therapy, right? It's like there's a wound, right? And it's sort of healing up, but there's pus underneath, and now we're opening it up and we're cleaning it. I don't know, just that was a very social metaphor there. So that's what I have. And now, Siri, I want to see if we have questions.
Thank you. In fact, it's interesting because when people knew this webinar was being put together, questions came in advance, and
Excellent.
as you were going through, I was like, oh, she just addressed that. Oh, she just addressed that, which is wonderful just because of timing.
Right, yes.
So
excellent.
One question that did come in, when you listed the different kinds of therapists, so psychologists, marriage family therapists, LCSW, how does a person know, what is the difference between those different lines of education and licensing?
Right. Yes. Well, yes. So, I mean, I think the most kind of, if we think just about like years of education or training, right? Some of the most intensive educational experience comes, like if we're giving psychiatrists and psychologists. And one of the best therapists I know is a licensed clinical social worker, right? Because of their lived experience and their additional education and who they are as a person, right? So how do you know? I mean, I would say honestly, if you're just looking for therapy, don't start with a psychiatrist. I'll tell you why. Some of us can be wonderful psychotherapists, but also let's say, for example, maybe like, let's say you're at Stanford CF Center, you want somebody who knows CF, and I have time, that's fine, that's different. But let's say in the community, right? Because especially if you have a provider in the community, psychiatrists probably will charge more. And you don't need that. So that just kind of, just for the cost, you don't need that, right? If you want a provider who provides medications and the psychotherapy all in one, well, then maybe psychiatrist is the person for you. At the same time, you can have a therapist who's a social worker or MFT or psychologist, and you can have a psychiatrist separate, right? And it's just honestly preference. And also, obviously, not all psychiatrists do psychotherapy. In terms of the psychologists, also go to graduate school and then do a lot of practice, and they really schooled in behavioral sciences. Social workers, right, there's a different type of training, and often this kind of very hands-on training. What I find for people with CF, many social workers who become therapists are excellent because they know the lived experience and they often come from the clinical setting, right? So I find that the social workers or therapists who know CF, they're excellent because they have the training, they know CF, they know the lived experience of people with CF. But honestly, sometimes I would say don't necessarily be too hung up on psychologists, say social work or MFT. See what the patient, what do they say they practice, see their license, right? If you have any reviews, look at those. Although I'm always skeptical about online reviews because it's, people who have hot feelings either way, right? Kind of report. But, I think it's kind of like, it's really look at their profile and meet with them.
And for a person, this was another question. At what point, if a person is in therapy and they feel that it is not that it's not helping, but that there may be a need for medical intervention as well. So i.e., is it a psychiatrist that then you would need to have the consultation with the psychiatrist, or can the person continue with their therapist and work through a physician? What are the options for people?
Yeah, no, absolutely. I mean, I think, let's say you've tried therapy for 2-3 months. I mean, it might take some time, right? And there's no change, right? And it affects your functioning, right? That might be, it really affects your functioning, right? You're so anxious, you're so depressed. I mean, that might be time to kind of think about, okay, do I also want to seek psychiatric consultation? And, whether you seek a professional psychiatric consultation versus, let's say, primary care physician, or even, in CF clinics, some people, right, some providers, some pulmonologists feel comfortable prescribing this as advice. I mean, I think it depends, right? I mean, if you really have a major, I think it depends on the severity, right, of your condition, but also access, right? If your therapist is working with a psychiatrist already, or there's an easy referral, I say, why not, right? And you can continue doing therapy and then see a psychiatrist. If there's a long line, then maybe start with a different physician or pulmonologist. Also to make sure that, they can rule out things like thyroid problems or something else, right? Because obviously there's medical factors that can also influence how you're feeling, and medical psychiatrists can do it as well. And often, especially if you have moderate to severe depression, anxiety, it really might be a combination of therapy and medication that works the best, right? Because sometimes somebody's so depressed or so anxious, they can't even make it, right, to the therapy, right? Or it's too hard to work through the issue. Sometimes medication can kind of decrease the distress to the extent that then people can actually really engage in the therapy and build skill, right? So often they kind of actually go hand in hand. But you can also ask your therapist, right? If you're not sure, ask your therapist. I mean, they will also be able to refer you often appropriately to say, yes, we need something else.
And that really was about access, just because we know in many parts of the country,
Yeah,
it's very hard to find a psychiatrist.
right.
So,
yes, but a primary care physician can definitely evaluate you for depression, anxiety, and let's say we start with SSRI.
And then another question, with the other modalities, not the psychiatrists, are they able to make a diagnosis, whether it is bipolar disorder or?
Yeah. I think, right. I mean, a good psychotherapist should, they should, right? They should have an evaluation and they should be able to make a diagnosis according to our psychiatric Bible, which is, DSM-5. And you can ask them, right? I think that's also fair to ask, like, hey, look, what is my diagnosis, right? But I would say if the diagnosis is something, I think something like depression or anxiety, let's say personality disorders, right? I think that all can be treated potentially just by therapy, right? But if the diagnosis is something like bipolar disorder, schizoaffective disorder, especially complex PTSD, I really think that then psychiatrists should be involved, right? ADHD, right? So there's some diagnoses that are, there's more, right? There's no suffering associated, right? There's no morbidity, we worry about them more, right? So, I think at that point, definitely, that's not the reason to really be referred to psychiatrists.
I'm going to fly through these questions.
Yeah.
At what point could a person who's on medication, say for depression, Zoloft, Prozac, or what have you, and they decide to stop medication, how does one know what improvements are due to the medication and what are due to the non-medical therapeutic intervention?
Yeah. Okay. And I feel like there are, actually a few questions there. So for example, what do you know when can you stop medication, right? I would say, let's say you had one depressive episode, one anxiety episode. Yes, sure, be treated and then kind of stop in a while. A while means you want to be on the medication for at least 6 months to a year. It's not something you feel better for 2 months and then you stop it, right? And please discuss with your provider who's prescribing it to you, right? But you can try to taper it off, right, and see how you do. And you don't want to just stop it cold turkey, right? You do want to kind of taper that off. And let's say, right, if symptoms were to come back, well, maybe that's a sign that really they're helping you manage, right? There might be something chronic that's happening that's helping you manage. But also the idea is the hope is when you combine medications with therapy is that you start medications, you feel like you can tolerate more distress, and then you build new skills, right? And hopefully then you're able to use those skills. So then we taper off medications and you feel better, right? Because now you actually have more skills that you've built in psychotherapy and you can practice that, right? And I think if the effect continues, I think that might be that now you just have more skills to deal with kind of what's on your plate. If somebody did have a major depressive episode, there's 50% chance that they might have another episode later on. So it might be that later on you might need medications again, right? And at some point there's a discussion of should we just continue chronically.
And sadly, I think this has to be our last question.
Right.
But the stigma of mental health services and I think it's getting better societally, but it still exists. And the question was, how can I talk to my loved one about trying therapy if they're hesitant? When I think part of the hesitancy is embarrassment or the stigma.
Yeah. So your loved ones, you think that your loved ones need therapy, and how do you talk about them, right? I think, it's hard, right? You can be authentic. You can say that, listen, I really see that you're suffering and you're struggling. And I think that's something that can be very helpful. For example, if that's something that you've done or you do it, you can say, listen, I've been doing this and it's been very helpful for me, right? So kind of, that sharing can be very helpful, and say that I would be so proud of you, right? I know that it's sometimes people are afraid that they appear weak, right? That they should be able to handle it on their own, right? And versus asking for somebody else's help. But it's actually a sign of strength to be able to ask for help, right? And we do live in a community, like that's what we do. So just really talking about that I would be so proud of you, it would be so incredible, and it would mean so much for me. And then on the other hand, right, it's an individual decision. I think at some point, if somebody is not ready, right, you cannot make them do that, right? I think that's also kind of something you can try to inspire them and motivate them, use some of the motivation interviewing, but eventually, it is sort of, if somebody's not there yet, just maybe circle back, right? Say, hey, how can I help you? Do you want me to help you make some phone calls, right? Maybe it's about behavioral activation piece, right? Kind of really help them find somebody. What steps can I take? So I think that practical support can also be helpful.
Well, Dr. Sher, as always, you are such a gift to the community, and we're so grateful to you for taking the time to share your wisdom and your expertise with us. And I have a feeling more questions will come in later, so hopefully I
can email me
back to you and we'll get those answered. For those who are here with us today, thank you. And a reminder, if all of this has triggered a desire now to seek therapy, please do contact CFRI if you are needing some financial support to make that happen. Just to make it really easy for everybody, CFRI at cfri.org, and it will get directed to the proper person to connect you. But this has been a wonderful resource, and we are grateful to you, Dr. Sher. Thank you.
My pleasure.